most beautiful things you get to see is that connection with someone who so many people have overlooked. The phrase that gets often said is, you didn't look away. And I think that's what happens here. I think that's one of the reasons why we're so successful.
A group of organizations in downtown Portland are pulling together their resources to help the homeless get back on their feet by building trust and reestablishing dignity. It all starts at an outreach van handing out coffee, where those in need can collect tickets to enter the facility. The first 2 floors of the Behavioral Health Resource Center are operated by the Peer Company.
This is where they will initiate service. So if they're wanting to do showers or laundry, they will sign up for that here. So they're really going into this space with purpose.
These floors act as a day center where people can simply come in to escape the elements or receive a meal, do laundry, take a shower.
They can take what they need
And have access to any hygiene needs.
Lice treatments, denture care, feminine hygiene products, sexual health products.
Grab something they may need from a clothing closet.
It is donation-based.
Use a computer or phone, and even receive mail.
So the mail is, a huge access piece. Like anybody who has ever tried to get housing, get food stamps, get health care, without having a physical address to receive mail, it's pretty impossible.
The 3rd and 4th floors act as a shelter run by Do Good. Here is where people are able to enter in 90-day programs, are offered short-term beds, resources to detox and get on the road to recovery, and finally, find a stable housing situation. BHRC considers themselves a low-barrier shelter, meaning there are no prerequisites, no insurance or ID, and no proof of sobriety is required to enter the facility.
It means you do not have to be sober to enter. Our hope is by the time you leave, you are.
They even have a vending machine to dispense free Narcan for those who want it.
If we are seeing folks who are engaging with the Narcan vending machine, it kind of gives us the opportunity to talk about other tools.
No, they are not allowed to use here. We're not sitting here passing out needles. Okay. We're not doing anything like that. What we are doing is, I can give an example of someone without giving too much information. Hey, the next time you think about that, come grab one of us. We'll sit down, we'll have a conversation. That conversation leads to sobriety. You're going to sit down. I learned your name. You're no longer looking towards escaping reality. You now have someone who's going to sit with you in reality, and that's the cure.
The Peer Company is unique because they only hire those with what they call lived experience. And it's no easy feat. Each staff member has to be clean and undergoes an 80-hour peer wellness specialist training and must keep up with continued education.
Working for and being a peer-run organization means a majority of our staff are in recovery and have lived experience with substance use or mental health. They've also all completed training to become certified peer support specialists.
Miranda Grimaldi, the senior director of BHRC, suffered from generational challenges with substance abuse and addiction. She says becoming a mom is what finally gave her the strength to get clean.
I think I'm very proud and honored to be a part of the community that did make it and has this opportunity to be a change and be a hope and be a guiding light for people. And so that would be my hope for my kids, is that they see that and they know that, like, no matter what this life has to offer, like, there is always hope and there's always room for change.
Since opening in December 2022, the Peer Company serves an average of 106 people daily, while Do Good has served over 1,000 people since opening in July 2023. The team hopes to reach even more every year.
Our goal is to put all of ourselves out of work. Maybe one day this doesn't have to exist.
He's like, guys, help me, help me.
From Portland, Oregon, I'm Amy DeLaura for Washington Examiner.